Good evening, everyone. Welcome to this INICET Prepathon from MEDACE. I am your pharmacology faculty, Dr. Arpit, and I welcome you to this special session where we are going to discuss the most important topics expected in the upcoming INICET. I hope you are as excited as I am about this session. Manipal MEDACE is committed to your success in the INICET NEET PG, and this is a special series that we are doing to help you prepare for the upcoming INICET. We will have continuous daily sessions till April 20th, covering all the subjects. And Learn Anatomy has joined. Good evening, Learn Anat. Good evening, Karthik. I hope you are doing well, and I hope my audio and video is clear to you. Give me a thumbs up if the audio and video is clear, and we will begin. Good evening, Aniket. Good to have you. Good to have you in our session. Good evening, Narendranath Reddy. Good to have you in the session. We are just waiting for a few more students, friends to join, and we'll begin. So as you all know, INICET is one of the most important exam, and pharmacology can be the rank decider in this exam. Now pharmacology, we are going to do some of the most anticipated questions, topics based on the previous year's examination in this session. I'll take you through the MCQs, I'll take you through the confusing points, we'll discuss and revise all the important points for these important drugs and topics. Okay? Thank you. Thank you, Dr. Agityan. Thank you, Dr. Aniket. Welcome, Kyle. Good to have you in the session. So, we'll now begin. Okay. So, we are going to discuss some of the most important topics based on the previous year's questions for the upcoming INICET. So, let us see what is the first topic that we have for us. The first topic in pharmacology that is very, very important, repeated many times in the recent exam, both in INICET and in NEET, is the Disulfiram. So, this is a very, very special session. What I have done, I have created unique MCQs that will ask all the important points regarding that important topic. All the important points summarized in one questions. You have to look at this MCQ which says true about disulfiram. True about disulfiram, and tell me which of these following are true. So this is a INICET pattern kind of thing which we will attempt. New pattern of MCQs, and we'll try to summarize all the important points regarding this important topic, disulfiram. Okay, so let me know what is the correct answer in your opinion. The first option is action persists for days after being sopped. Second is anti-craving drug. Third is respiratory depression and reduced consciousness if given with alcohol. Fourth is used in unmotivated patients. And fifth is best drug in patients who are physically dependent on alcohol. Tell me what is the correct statement about disulfiram. Is it option A 2 and 4, B 1 and 2, C 1, 3 and 5, or D 1 and 3? Welcome, Abhishek, good to have you back. Tell me, yes, my dear friends, tell me the answer to this particular question. What do you think is the answer? Option A, B, C, or D? Type your options in the comment section. Dr. Pagara is the first one to say, who says D. Any further attempts? Dr. Karthik, Dr. Learn and Art, Dr. Abhishek, Dr. Agityan, Gokul. Welcome, Gokul. Gokul also says D. 1 and 3. Anybody who goes with anything besides D? Anybody else? So let us see. Disulfiram. What is disulfiram? Disulfiram is a competitive inhibitor of the enzyme aldehyde dehydrogenase. The issue is this is an irreversible inhibitor of this enzyme, so its action will persist for days after being stopped. This is the correct statement. Is it an anti-craving drug? This is a false statement. It is not going to decrease the craving. It does not reduce the craving. It is used as an aversion therapy. So 2 is false statement. Respiratory depression and reduced consciousness if given with alcohol. This is true. If patient consumes too much alcohol after taking disulfiram, he will have aldehyde syndrome, which can result in respiratory depression and even collapse. Used in unmotivated subjects, this is absolutely false. It is used only in subjects who are motivated to give up alcohol. And 5th, best drug in patients who are physically dependent. This one is also false. It is never given to patients who are physically dependent on alcohol. So we have 2 correct statements, that is statement number 1 and 3, and that is why option number D. Option number D is the correct answer. Option number D is the correct answer. So Gokul, you were initially correct, and so was Dr. Agarwal. Very well done, very well done. And now in the same topic, as I said, we are going to revise the topic in its fullness. So another important point which comes with disulfiram is drugs with disulfiram-like reaction, and I'll tell you which are the drugs which have disulfiram-like reaction. The mnemonic is C is GMP. Very simple mnemonic, C is GMP. Drugs with disulfiram-like reaction. C stands for several cephalosporins. So cephalosporins like cefoperazone. Cefoperazone is one important name which has disulfiram-like reaction. C can also stands for cotrimoxazole. C can also stands for cotrimoxazole. Then we have I. I stands for the important TB drug isoniazid. I stands for isoniazid. I stands for isoniazid. S stands for the anti-diabetic sulfonylurea. Sulfonylurea like chlorpropamide. Chlorpropamide. G stands for the antifungal drug Griseopulvin. M stands for very popular metronidazole, very popular and commonly used antibiotic. And P stands for the anti-cancer drug procarbazine. Very good, Gokul. So these are the drugs, these are the important drugs which have disulfiram-like reaction, and all these drugs should be avoided, should be absolutely avoided in any patient who is taking disulfiram. And these drugs, if the patient is taking, he should absolutely avoid consumption of alcohol. So this was our first topic, disulfiram-like reaction. Very important. We have completed this topic, disulfiram-like reaction. Many questions have come from this topic in the recent past. Okay, so I hope you like this question. Give me a thumbs up if you like this question. We'll move to the next one. Okay, don't forget to like the video and subscribe to the channel. Remember, this series of INICET Prepathon is going to continue till 20th of April, and tomorrow we are going to have another important session by Dr. Meenakshi Sundaram on biochemistry. So please subscribe to the channel and do not forget to like the video. Moving ahead, another important topic from anti-epileptic, that will be Valproate and the phenytoin side effects. Very important topic. This again, let us see the question. Let's see the question. What does the question says? The question says that we have a 25-year-old male. We have what? A 25-year-old male with treatment with a combination of Valproate and phenytoin. He has good control of seizure. All of the following adverse effect can be attributed to Valproate except. So So which of these four is not a side effect of Valproate? The patient is taking Valproate and phenytoin. Okay. So tell me, which of the following is not a side effect which can be attributed to Valproate? Thank you, Dr. Minakshi. Weight gain of 5 kg, serum alanine aminotransferase increased to 150, rise in serum ammonia level or lymphadenopathy, which cannot be a side effect of Valproate, maybe because of phenytoin. So you have to tell me. Yes, I'm looking for answers. Quickly. Now we have to pick up the pace. Quickly tell me so that we can revise the side effects of Valproate and phenytoin, and I'll give you some really cool mnemonics here. Tell me. Yes, anyone? Gokul, Dr. Agara, Abhishek, Kyle, Learn and Art, please. D. Gokul says D. Anybody else? So let us see what is the correct answer. D is the correct answer here. Lymphadenopathy. Lymphadenopathy is most likely a side effect of phenytoin and not because of Valproate. Now how to remember the side effects of Valproate or phenytoin? So let us see. These are the side effects of Valproate. This is what you get when you take Valproate. What is the mnemonic? What a plan. Simple mnemonic, what a plan. What is W? W is weight gain. So please remember, Valproate stimulates appetite. It stimulates appetite, causes weight gain. H is very, very important. It is hormonal disturbance. It affects estrogen metabolism in females, leading to PCOD. Polycystic ovarian disease or polycystic ovarian syndrome can occur because of Valproate ingestion in females because of the estrogen metabolism affection. Then we have A for ataxia and T for tremor. Ataxia and tremor, not very important, not very commonly asked. Very, very commonly asked is A, which says alopecia. So hair loss. Alopecia is a common side effect seen with Valproate therapy, and the new hairs which come once the patient's hair goes away, some new hairs come and they are curled mostly. So alopecia following by curling of hairs. Then P is pancreatitis. Pancreatitis can be there. L is very, very important. It is liver toxicity or liver damage or hepatitis. And you all know, in children who are less than 2 years of age, this Valproate induced liver toxicity can be even life threatening. So we never give Valproate to children who are less than 2 years of age. A, if liver is damaged, obviously ammonia will increase. Ammonia goes up, hyperammonemia. Now the question was asked, how will you treat this rise in ammonia caused by Valproate? So please remember, L-carnitine. L-carnitine is the drug that is given to treat this hyperammonemia caused by Valproate. L-carnitine, and this was asked in recent INICET. And finally we have N, which says neural tube defects. Neural tube defects or spina bifida. Spina bifida, that's a common problem seen with Valproate ingestion in pregnancy. So these are the side effects that we see with Valproate. Now coming to the side effects of phenytoin, again very, very commonly asked. And what is the mnemonic? The mnemonic is phenytoin itself. So P is the pseudolymphoma. Pseudolymphoma is nothing but lymphadenopathy. Remember, phenytoin causes lymphadenopathy, not Valproate. So lymphadenopathy is caused by phenytoin, that is sometimes misdiagnosed, wrongly diagnosed as pseudolymphoma. H can be hypertrophy of gums, which is the commonest problem. Hypertrophy of gums, which is a commonest side effect seen with phenytoin. H can also be hypersensitivity reaction. H can also be hypersensitivity reactions. Think there was some error in the mic. Apologies for that. H can also be hypersensitivity. N, we've taken a slight liberty in order to create the mnemonic. N actually is anemia, which you all know actually is anemia, and it is the megaloblastic anemia. Megaloblastic anemia due to folate deficiency can be caused by phenytoin. Then avoid phenytoin in young females. You should avoid phenytoin in young females because phenytoin will cause acne and hirsutism. So avoid phenytoin in young females. Phenytoin is a known teratogen, that is T. So it causes fetal hydantoin syndrome. Fetal hydantoin syndrome, you can have cleft lip or cleft palate, and very, very important, you have digital hypoplasia. Digital hypoplasia, the fingers are not properly formed, and that's a very, very common abnormality seen in children of the females who took phenytoin during pregnancy. O stands for osteomalacia, and IN stands for inhibition. Inhibition of insulin release. So it decreases insulin release, and that obviously leads to hyperglycemia. So these are side effects seen with phenytoin. The mnemonic is phenytoin itself, PHENYTOIN. If you remember this and the previous slide where we discussed the side effects of Valproate, I am sure you will find at least one question which can be solved with these two slides only. So side effects of phenytoin and Valproate are very, very, very commonly asked questions. Okay. So I hope these side effects are clear. Any problem, anyone? Yes. Anybody? Having any problem so far? Okay, please continue to share this session live in your groups. Please continue to like and comment. Moving ahead. Another important topic again from CNS, lithium. Pharmacology questions in INICET usually are not complete without a question regarding lithium. So lithium is a very, very important drug in pharmacology. Let us see, what do you know about lithium? Can you solve this question about lithium? So there are 4 statements which are given. It's contraindicated in pregnancy, causes tremor and leukocytosis. Sodium ion is a specific antidote for lithium clearance and causes benign and reversible depression of T waves on ECG. Thank you, Dr. Abhirami. So which of these statements are true about lithium? Yes, all of you. INICET is approaching. I am sure you have revised lithium. It's time for you to think hard and come up with the correct answer. Can you solve these kinds of questions? These kinds of questions require deep learning. All the important points you should be completely sure about. So tell me, is 1 and 3, 1 and 4, 1, 3, 4, 2, 4, which one is the correct? A, B, C, D. Yes. So please participate. See, we conduct all these YouTube sessions to see your participation. Without your participation, these sessions become one way or very passive mode of teaching. So I will request, yes, Dr. Vijay, very good, you're saying C. Hariharan, very good, D. So please participate. Whatever you think, consider it like exam. These are all important topics. You have all read these topics. It is time for you to just test whether you remember it or not. So let us see. Contraindicated in pregnancy. Contraindicated in pregnancy. Yes, it is true. It causes Epstein anomaly. So it's contraindicated in pregnancy. Do not give in pregnancy. Causes tremor and leukocytosis. Yes. Fine tremor. Fine tremor is one of the commonest side effects of lithium, and the WBC count also increases. Leukocytosis is one of the commonest side effect. Sodium ion is a specific antidote. False. There is no specific antidote for lithium. We have to perform what? Hemodialysis if lithium overdose occurs. Causes benign and reversible depression of T waves. Yes, it can do. So this is also a true statement. True statement. So how many truths we have? We have 1, 2 and 4. 1, 2 and 4. So this should be actually 1, 2 and 4. And this is our correct answer. Option number C. Option number C. Let us see. Let us see how to remember. How to remember now. So lithium points, side effects are very, very important, and I'll give you this particular mnemonic. So the mnemonic is test tube weak. This is the mnemonic. Now what all will be caused by lithium as a side effect, and therefore what all should be test or monitor during lithium therapy, that we will remember both the things in the same mnemonic. So we have to monitor thyroid function test. If a patient is on lithium, you will monitor thyroid function test. Why? Because lithium mostly causes hypothyroidism, but sometimes it may cause hyper also, but mostly it causes hypothyroidism. It inhibits release of hormone from the gland, so hypothyroidism, and as a result lethargy, weight gain, etc. can occur. If there is going to be hypothyroidism, weight gain is going to occur. So you have to monitor the weight of the patient. Weight of the patient you should monitor regularly. Next thing you should test or monitor is urine pregnancy test. Measure or confirm urine pregnancy test before starting the lithium therapy in a reproductive age group female. Why? Because lithium is teratogenic. Lithium is a known teratogen. And which problem does it cause? Which teratogenicity in fetus does it cause? I hope everybody is aware. This is the teratogenicity for you. Epstein anomaly. Epstein anomaly is the teratogenicity. You can see defect mainly in the tricuspid valve. You see this region of the heart? Tricuspid valve is displaced. The right ventricle is very, very rudimentary, and right atrium is enlarged, and most of the time, not definitely, but most of the time there is also a patent foramen ovale. So Epstein anomaly, which side of the heart is affected? As you can see, right side of the heart, tricuspid valve defect. So do not give lithium during pregnancy. Okay, so we'll come back, and therefore you have to monitor urine pregnancy test during or before starting lithium. Also monitor the blood counts. BC is blood count. Perform regular blood counts, because lithium causes leukocytosis. Increase in WBC can occur because of lithium. You have to monitor ECG of the patient. ECG should be monitored. It can cause T wave depression. It can also cause sick sinus syndrome. It can suppress atrioventricular conduction. Sick sinus syndrome or partial block can occur. So monitor ECG, T wave depression. Physical examination you should perform regularly, because lithium is likely to cause edema, which can also contribute to weight gain. Electrolyte, very, very important to check during lithium therapy. Particularly, lithium can lead to hyper of calcemia. Very, very confusing point. देखो बच्चों, हाइपर कैल्सीमिया होता है लिथियम में. वाई? इट कैन कॉज, लिथियम कैन कॉज रिलीज ऑफ पैराथायरॉयड हार्मोन. हाइपर पैराथायरॉयडिज्म कर देता है लिथियम. इट कैन कॉज रिलीज ऑफ पैराथायरॉयड हार्मोन दैट कैन कॉज हाइपर कैल्सीमिया. This is a very confusing point. Students forget it. So please remember to check serum calcium or electrolytes during lithium therapy. And obviously lithium can cause renal problem. Particularly it causes nephrogenic diabetes insipidus. Nephrogenic diabetes insipidus. It can also cause nephritis. So monitor the KFT. So what all you will monitor or test during lithium therapy? You will test thyroid function, UPT, blood counts, ECG, weight, examination, electrolytes and kidney function test during lithium therapy. Why? Because lithium is causing the side effects written on the right. And finally with the T, you can remember the most common side effect. Most common side effect of lithium is fine tremor. Very fine tremor which can even be missed. So these are the side effects seen on a normal dose of lithium, and what precautions you must take as a physician, as a doctor, if a patient is having lithium therapy. Okay, so everybody clear? How to remember lithium, what all tests to monitor, what all problems can occur, and how to remember it. Test tube weak, TFT, UPT, blood counts, ECG, weight, examination, edema and KFT. Okay, so everybody clear? Anybody having any confusion? Very important topic, lithium. Everybody should be absolutely clear on what to study in lithium. We cannot afford to have any confusion, any problem in lithium. Yes, Dr. Gokul, Dr. Gayal, Agathian, Hariharan, everybody clear on lithium? Give me a thumbs up. Show me some love if you like this particular question. Here is the Epstein anomaly for you. Right side of the heart, lithium ingestion, tricuspid valve defect, rudimentary right ventricle. Lithium should be avoided in pregnancy. So we move ahead. I hope you are finding that these are the important topics that are asked frequently in the INICET, and we just cannot depend on solving one question from a previous year topic. We have to understand the topic in its completeness. Okay, all the points related to the previous year's topics or important topics we must be able to revise. Okay, moving to the next question. Thank you, Kajal. Moving to the next question. SSRI, very important drugs, both clinically as well as in MCQ from pharma and MCQ from psychiatry. Every year you will find one question either in pharmacology or in psychiatry directly or indirectly related to SSRI, selective serotonin reuptake inhibitors. Question is very simple. SSRIs are drug of choice for which conditions? SSRIs are drug of choice. Simple question. Depression, OCD, neuropathic pain, fibromyalgia, PTSD. Tell me, what is the correct answer here? What is the correct answer? We have many live students but only 7 likes so far. Please do not forget to like the session. Do not forget, it's a small gesture from you, but it is really important. It's really important. We put in a lot of effort and we request you for your thumb to press that like button and also the subscribe button. Do not forget to press the subscribe button. Okay, so Kyles and Gokul says D. So SSRIs are drug of choice for depression. That is correct. Obsessive compulsive disorder, again SSRIs are the drug of choice. Post traumatic stress disorders, SSRI. For fibromyalgia, nowadays SNRI. SNRIs like milnacipran, and for neuropathic pain we prefer drugs like pregabalin or gabapentin. They are the preferred drugs. So our options, the correct options are 1, 2 and 5. So option D is the correct answer. Now how to remember it? How to remember all the uses of SSRI? Very, very simple. SSRIs are drug of choice for ABCD, PP. That's the mnemonic to remember the uses of SSRI. Drug of choice for what? ABCD, PP. ABCD 2P. ABCD, PP. Very, very simple. ABCD. Let us see. What does this mnemonic stand for? SSRIs are drug of choice for. So in pharmacology, it's very important to make simple mnemonics for the important topics. Otherwise, fibromyalgia, Gokul, we use SNRI. SNRI like milnacipram or duloxetine are drug of choice for fibromyalgia. Now coming back to SSRI, they are drug of choice for A. A stands for anxiety disorder. Which kind of anxiety disorder? Generalized anxiety disorder. Now generalized anxiety disorder, some students come back and they say, no sir, we have read that benzodiazepines are drug of choice. So let me tell you, SSRIs, tricyclic antidepressants, benzodiazepines and azapirons like buspirone. So 4 classes of drugs I have written: SSRI, tricyclic antidepressant, benzodiazepines like alprazolam and buspirone, which is a class of azapirone. All are first line drugs. All can be started in a patient of generalized anxiety disorder. Now some of the books do mention benzodiazepines, but we have to remember that there is a problem of abuse liability and sedation with benzodiazepines. So we will not prefer them as drug of choice. We will not prefer them because of these 2 reasons: abuse liability and sedation. So if you are asked first line drugs, all 4 are first line, but if you are asked drug of choice out of this, SSRI should be the one that is preferred. So SSRIs are drug of choice for generalized anxiety disorder. Then BCD. BCD. What can be B? B stands for eating disorder like bulimia. Bulimia nervosa. So fluoxetine. Fluoxetine is considered the best drug for eating disorder like bulimia nervosa. C. C stands for compulsive obsessive disorder or obsessive compulsive disorder, where again SSRIs are drug of choice. D stands for depression. P stands for any kind of phobia. And next P stands for PTSD, post traumatic stress disorder. So these are the six conditions where SSRIs are drug of choice. Obsessive compulsive disorder requires further discussion. If we have a case of resistant OCD, patient was given SSRI like fluoxamine, but is not responding completely to the SSRI, resistant case of OCD, then can you tell me any of them, what will be the drug of choice? What will be the drug of choice for a resistant case of OCD? So for OCD, drug of choice, first drug is SSRI. But if the OCD becomes resistant to SSRI, then who is going to tell me what will be the drug of choice? This was a question asked both in INICET and NEET PG in the recent years. Resistant case of OCD. Yes. Everyone, I want everybody to answer. Everybody should answer. Whether you are right or wrong, it does not matter. This is between us. This is just us testing ourselves. Do we remember or have we forgotten again? So let me see what is the drug of choice for resistant cases of OCD. Please, Use your fingers, which you are very good at. Chat box, type your answers. What is the drug of choice for resistant OCD? Yes, Dr. Agathian, Dr. Gokul, Dr. Kyle, Dr. Hariharan, I want everybody to answer resistant case of OCD. Yes बच्चों, क्या है resistant cases of OCD की दवाई? Which is the answer? No one? So the answer is a tricyclic called as clomipramine. Clomipramine is a tricyclic that is the drug of choice if SSRIs are not providing sufficient response. Okay, so that is about SSRIs uses. Okay, I hope you can remember all the uses and related question. Dr. Agathian, in panic attack we use benzodiazepine. Panic attack, we need the fastest acting anti-anxiety, and that will be benzodiazepine. Okay, so SSRI is for generalized anxiety disorder, not for panic attack. Moving ahead, we still remain with SSRI, a very, very important topic. So one more point we have to discuss from SSRI, and that is about their side effects. Select true statements about SSRI. Okay, so now the question is about their side effects. So select the true statements. Select the true statement about SSRI. Tell me. Dr. Agathian, for performance anxiety, give beta blocker. Performance anxiety main symptoms are tremor, sweating, tachycardia, palpitation. Beta blockers like propranolol, non-selective beta blockers are sufficient for performance anxiety. Tell me the answer to this particular question. Tell me the answers. SSRI should be avoided in patient taking triptans. What is the possible issue with triptans? Triptans means sumatriptan-like drugs for migraine, and SSRI, I don't know. Fluoxetine causes maximum discontinuation syndrome. Have you heard of this term, discontinuation syndrome? What is this? Paroxetine used in pregnancy can cause congenital cardiac malformation. Do you know anything about it? And SSRIs cause sexual side effects including premature ejaculation. Which of these statements are true? Which of these statements are true? Yes. So Dr. Kyle says A. Dr. Kyle is saying A. Let me know what others feel. 1, 2, 3, 4. Which are true? Only one answer so far. So let us see. Gokul says B. Very good, Gokul. Let's see. SSRI should be avoided in patients who are taking triptans. This is a true statement. This statement is true. SSRIs and triptans together can cause serotonin syndrome. Serotonin syndrome can occur. Fluoxetine causes maximum discontinuation syndrome. False. Discontinuation syndrome occurs with short-acting drug. On discontinuing the SSRI, rebound depression or nervousness can occur. It happens with short-acting SSRI. Fluoxetine is the longest-acting SSRI. Longest. So it will cause minimal, least discontinuation syndrome. So this statement is false. Paroxetine can cause congenital. This is true. Pulmonary hypertension and cardiac valvular defects can occur. If a pregnant woman takes paroxetine, then her child may have pulmonary hypertension, cardiac defects. SSRIs cause sexual effects including, now you see this was the catch, including premature ejaculation. This is again false. They cause delayed orgasm or no orgasm. So delayed ejaculation, not premature. They treat premature ejaculation. They cause anorgasmia, delayed orgasm. So therefore the statement is false because premature ejaculation is written. So what are true statements? 1 and 3, and we have option number A as the correct option. Option number A. Very good, Dr. Kyle, you are absolutely correct. A, option number A, that is 1 and 3 are the correct statements. So let us see the side effects of SSRI. What is the mnemonic? Mnemonic is SSRI, treat depression. That's a simple mnemonic to remember the side effects of SSRI. SSRI, selective serotonin reuptake inhibitor. How do you remember? SSRI treat depression. S. Now you see S stands for stimulation. These drugs stimulate 5-HT3 receptors in GIT, and that leads to increase in GI motility, leading to nausea, vomiting and diarrhea. These are the most common side effects with SSRI. Stimulation, SS, stimulation. They stimulate 5-HT3 receptor in GIT, GIT motility increases, nausea, vomiting, diarrhea, most common GI problems. Then SSRIs are increasing serotonin action, so serotonin syndrome. Serotonin syndrome can occur. Excessive serotonin increase can cause hyperthermia. This occurs if you give SSRIs with triptans, other serotonergic drugs like triptans, if you give them with tramadol, if you give them with even MAO inhibitors. So do not give SSRIs with these 3 drugs. The list is quite long, but only 3 are asked in exam. So remember, only 3, at least these 3. SSRI given with the triptan, with the tramadol or with MAO inhibitor will cause excessive increase in serotonin, leading to serotonin syndrome. So do not combine SSRIs with these drugs. Very, very, very important. R stands for reproductive, or you can say sexual side effects of SSRIs. Sexual side effects, as I've told you, what do they cause? They cause delayed orgasm. Delayed orgasm. And it can be used to treat premature ejaculation. Sometimes there is no orgasm, anorgasmia. So they cause delay in orgasm, which can be used to treat premature ejaculation. Then insomnia, sleeping problems like insomnia, vivid dreams. So sleeping problems can occur. Treat teratogenicity. T stands for the teratogenic nature, which is seen mainly with paroxetine, SSRI by the name paroxetine. And I have already told you what does paroxetine cause. It causes pulmonary hypertension and cardiac valvular defect. Do not give in pregnancy. And D stands for discontinuation syndrome. Discontinuation syndrome. When you will stop SSRI, then rebound depression or nervousness, anxiety can come. Discontinuation syndrome will be maximum with short acting drugs like paroxetine, and it will be minimum with long acting drug like fluoxetine. So these are the various side effects important in SSRI. How to remember? SSRI treat depression. Very simple. S for stimulation of GIT, another S for serotonin syndrome, R is for the reproductive side effects, I is for insomnia and related sleep problems, T is for teratogenic, and D is for discontinuation syndrome. So this is how you remember all the points related to SSRI in one question. Okay. So I hope now you are clear. SSRI's side effects you have done and SSRI's uses you have done. These are the 2 things you need to remember in SSRI. One question guaranteed you will get in INICET, whether in pharmacology or in psychiatry. Okay. So bachcho, I hope you are liking the session. You're finding these questions useful. These are not the simple routine PYQs that I have just taken. I have put in lot of information in one question so that you can use them for rapid revision at the end. Okay, that's the aim. Let us move ahead. Now Theophylline, another important drug you will find if you will revise PYQs. You will find Theophylline is one drug which also comes very, very commonly in INICET. Again, it can be as part of pharmacology or sometimes even part of medicine. So let me know which statement is true regarding or correct regarding Theophylline. So Theophylline is our next drug of interest. Theophylline. So tell me about theophylline. Yes, it is a non-specific phosphodiesterase activator. Statement number 1. Has a narrow therapeutic index. Statement number 2. Third is its metabolism depends on age. Fourth, it does not cross the blood-brain barrier. And fifth, it's an adenosine receptor antagonist. Tell me which one is the correct or are the correct statement. What do you think? Quickly. Theophylline, very important drug. Pharmacology, medicine. Sometimes even in pediatrics, theophylline is asked. You cannot afford to have questions on theophylline wrong. All important points about theophylline summarized in one question. Gokul has answered D. What about Dr. Kyle? What about Hariharan? Where are you, Hariharan? Dr. Agathian, Dr. Minakshi. Yes, let us see one by one. It's a non-specific phosphodiesterase activator. This statement unfortunately is false. It is a phosphodiesterase inhibitor, not an activator. Has a narrow therapeutic index. True. Very correct. Safety margin is low. Metabolism depends on age. Correct. Children metabolize it faster. Elderly metabolize it slower. Does not cross blood-brain barrier. This is false. It's a lipid soluble drug. Can easily cross blood-brain barrier. Adenosine receptor antagonist. This is a true statement. It blocks the adenosine receptor. So we have 2, 3 and 5. 2, 3 and 5. That is the correct answer. 2, 3 and 5. Option number D. Option number D is the correct answer we have here. Okay. So that is the correct answer. Very good, Dr. Kyle. Dr. Ray, Baby Ray has also joined. Let us see about theophylline. Now in theophylline, what are the important points to remember? Very quickly I'll summarize. 2 mechanisms of action. Mechanisms of action are 2. It's a non-specific phosphodiesterase inhibitor. Inhibitor or antagonist. It inhibits the phosphodiesterase enzyme. There are several types of phosphodiesterase in our body. It inhibits many of them, so non-specific. Second, adenosine type 1 receptor it also blocks. So adenosine receptor blocker. So it is a blocker of adenosine receptor and it is a blocker of phosphodiesterase enzyme. 2 mechanisms are there. Now it has a narrow safety margin. The serum concentration have to be maintained between 5 to 15 microgram per ml. If the concentration in blood is less than 5, effect will not occur. The benefit will not occur. And if the moment level in blood goes above 15 microgram per ml, you will have serious problems like even seizure or arrhythmia. So 5 to 15 is the required or the safe margin in blood. HICUS, as you can see, is the mnemonic to remember its side effect. Headache, increased acid, dyspepsia, cardiac arrhythmia, urination and seizure. Now what is asked in exam, please understand. What is asked in exam? These 2 side effects, that is diuresis and seizure, are due to blockade of adenosine. So adenosine antagonism is responsible for seizure and urination, and phosphodiesterase inhibition is responsible for headache and the GIT problems like dyspepsia. Okay, particularly the question in INICET was asked about diuresis. Why there is diuresis? That is because of adenosine antagonism. And headache and increased acid dyspepsia are due to phosphodiesterase inhibition. Cardiac arrhythmia is due to both adenosine antagonism also and phosphodiesterase inhibition also. So you need not just remember the side effects, you also have to remember why these side effects are occurring. So HICUS is the mnemonic to remember all the side effects. The last 2 are caused because of adenosine antagonism. The first 2 are caused because of phosphodiesterase inhibition, and the one in middle, cardiac arrhythmia, is caused because of both. So this also needs to be remembered. So these are few important points. Moving ahead with theophylline only, there are some factors which increase its metabolism, increase its clearance, and therefore you have to increase the dose in such patients? Because the metabolism is faster. It happens if the patient is taking enzyme inducers like rifampicin. If the patient is taking enzyme inducers like barbiturates. Children metabolize it faster, so children require higher dose. And smoking, please remember, very commonly asked, smoking also increases the metabolism, clearance of theophylline, so smokers also require higher dose. This was very recently asked. Higher dose is required in smokers. On the other hand, if the patient is taking enzyme inhibitors like erythromycin or ciprofloxacin, so which one? Erythromycin or ciprofloxacin. If these drugs are taken with theophylline, then metabolism of theophylline will okay. So some issue in technical problems there. We are back. So if the patient is taking enzyme inhibitors like erythromycin or antibiotics, let's say ciprofloxacin, both these antibiotics, erythro and ciproflox, are enzyme inhibitors, decrease theophylline metabolism, and you have to reduce the dose. Toxicity can occur if you give the normal dose. Elderly, you have to be aware, less metabolism, and liver disease, obviously metabolism decreases. So which questions have been asked? Questions have been asked on the toxicity, and questions have been asked that smokers require higher dose. These 2 points were recently asked in NEET and INICET. So these are the points about theophylline that we must be aware. I hope everybody is now clear on theophylline. Let's move ahead. We come to a very important topic from anti-arrhythmic. Again, a topic that is asked in pharmacology or in medicine, because the arrhythmias are asked in medicine, and amiodarone is one of the very important anti-arrhythmic. So which statements are true about this anti-arrhythmic amiodarone? Tell me. Narrow spectrum of anti-arrhythmic activity, decreases QT interval, increases action potential duration, causes Redman syndrome, often causes pulmonary abnormalities. Which statements are true? As I said, in order to solve these questions, you need to remember all important points about this important drug. And that's what we are trying to do. We are trying to revise the most important 25 most important topics for the upcoming INICET. So let me see some answers. Narrow spectrum of antiarrhythmic activity, true or false? This one is false. It is one of the broadest spectrum. Decreases QT interval, true or false? This one is false. It increases QT interval. Increases action potential duration, this one is true. It increases the width of action potential and the duration of action potential. Causes Redman syndrome, false. It causes Blue-Man syndrome. Redman syndrome is Vancomycin. Often causes pulmonary abnormalities. Yes, pulmonary fibrosis is one of the most common dose limiting problems. So 2 statements are correct, 3 and 5, and that's why Dr. Kyle, Dr. Gokul and Dr. Agas, you are absolutely correct, bache. This is option number D. Very well done, very well done. Others also need to participate continuously. Okay, do not hesitate, bache. Do not hesitate. It's just a practice. Everybody needs to participate and continue to share this session live with your friends. So please share the link of this session in your groups, in your WhatsApp group, in your Telegram groups. Encourage your friends to come and see how much they know. Okay, let's invite our friend also. Let's revise amiodarone. Now amiodarone, basically amiodarone is a class 3 drug which blocks potassium channels. So it is a potassium channel blocker. That is its main action. Class 3 antiarrhythmic blocks efflux, blocks going out of the potassium from the cell, potassium channel blocker, but it also has all other properties. That is, it is also a sodium channel blocker, it is also a calcium channel blocker, and the drug is also a beta blocker. So it has some amount of all other property. So it is the widest spectrum anti-arrhythmic. Widest spectrum. It can treat almost any arrhythmia except torsades. It's a wide spectrum because it has all the actions. Potassium is the main, but sodium blocker, calcium blocker, beta blocker सब है बच्चों इसमें. And as you can see on the graph, the black line shows the normal and the green dotted line shows the graph after giving amiodarone. So you can see initially the width of action potential is this much, and after giving amiodarone, because potassium channels are blocked, repolarization becomes slow and width of action potential has increased. So we can say it increases the width of action potential or action potential duration. That you can see width of action potential or action potential duration has increased. The same action potential duration when we see in ECG. So action potential duration in ECG is denoted by QT interval. So it will also increase QT interval. So this is the graph for image based questions. And what parameters does it increase? It increases action potential duration in the action potential graph, and in ECG it will increase which interval? QT interval mainly. So these are the points related to its mechanism of action. APD bada, QT interval bada. Okay. Now the second important point in amiodarone is related to its side effects. Very commonly asked. Very commonly asked topic. Side effects of amiodarone. What is the mnemonic? Please check my PFT, TFT, LFT. Why would we check somebody's pulmonary function test, thyroid function test or liver function test during amiodarone? We will check because amiodarone very commonly causes what? Pulmonary fibrosis. Pulmonary fibrosis, it can be caused as the dose limiting toxicity, DLT. Dose limiting toxicity of amiodarone is pulmonary fibrosis. TFT we will monitor during. Why? Because it causes thyroid abnormality, thyroid disorder. Both, most commonly it is hypo, but sometime hyperthyroidism, transient hyperthyroidism can also occur. Okay. Please remember amiodarone contains around 37% iodine by weight. So if you have a 100 milligram amiodarone tablet, it has 37 milligram of iodine. So much iodine when you intake, thyroid functions are going to be disturbed. So thyroid disorder, most likely hypothyroidism. You will also measure the liver function test because anything which range from hepatitis to liver fibrosis or cirrhosis. Anything can occur. Liver toxicity can occur during amiodarone. It's not very common, but it can occur. It's sometimes called as pseudo-alcoholic liver injury. Pseudo-alcoholic liver injury is a term given to amiodarone induced liver toxicity, which can range from fatty liver to hepatitis to cirrhosis. Anything can occur. Then P stands for mainly photosensitivity. Patient develops photosensitivity that results in bluish discoloration of the sun exposed part known as blue man syndrome. Red man syndrome, Vancomycin. Blue man syndrome, like me, blue man syndrome, bluish discoloration of the face, sun exposed part, amiodarone. C stands for corneal deposits. So corneal micro deposits can occur. And M stands for myocardial depression. So myocardial contractility sometimes can decrease during amiodarone therapy. These are the side effects which you need to know, particularly this one. Pulmonary fibrosis is the main problem. Most common complaint the patient has is usually a dry cough. Symptom patient presents with is dry cough and dyspnea. Okay, so this is what are the side effects and mechanism of amiodarone. The graph, all points about amiodarone covered. All points about amiodarone covered. Remember what we are discussing, most important topics, and we have to discuss the entire topic using one question. These are what we call as high yield question. You revise these questions, revise the entire topic, and I hope everybody is liking. Do not forget to like the session. Okay, also if you're liking the session, show some appreciation. A thumbs up would be greatly, deeply, hugely appreciated. So do not hesitate, show some love. That's what I want. Next question again from anti-arrhythmic, very very important topic. So we have to revise the anti-arrhythmic as a whole. Match the anti-arrhythmic drug to the condition it should be avoided in. Match the following. Another type of question that we see in INICET more, mostly, not so much in NEET PG or FMG. So INICET, we need to understand the topic, but we also need to apprise ourselves of the type of questions we anticipate. Okay, so tell me, anti-arrhythmic drug, it should be avoided in match. Disopyramide, procainamide, amiodarone, verapamil, beta blockers. Condition to avoid: glaucoma, arthritis, lung disease, constipation, asthma. Amiodarone we have already discussed. It causes pulmonary fibrosis, so that much we know. It should be avoided in lung disease. So 3 will go with C. What about others? Yes, Dr. Bababi, Dr. Gokul, Dr. Kyle. Let me see your answers. Kyle says D. So there is a trick in solving some questions, these kind of questions, which can sometimes make you very lucky. So out of these 5, like this question, I also want to bring out another point. When you're trying to solve this question, you can solve this question even if you do not know all the options. How? Like we have done. I just knew that amiodarone causes fibrosis of lung, so I would avoid this in lung disease. So 3 is going to go with C. So first of all, in such questions, find out the option that you are sure about, then come to the various option and see. Now in this question, in this example, 3 going with C is given only in one option. So whether you know anything about other options or not, this is the only possible correct answer here. Okay, so there are tricks to solving these. Match the following. What is the trick? Match the one that you are sure about and see which options have that sure short point. Sometimes, I'm not saying all the time, sometimes you can get lucky. Okay, so this A, B, C, D, E. Now let's see the explanation. Very very important. Disopyramide is anti-arrhythmic belonging to class 1A. Disopyramide. Quinidine, procainamide, disopyramide. It has very high. Disopyramide has very high anticholinergic activity. Anticholinergic activity, you all know, causes mydriasis. Mydriasis increases intraocular pressure, so you avoid this drug in glaucoma. Okay, it has high anticholinergic property. Anticholinergic property causes mydriasis. Mydriasis increases IOP, avoid in glaucoma. Procainamide, if you remember, is metabolized by acetylation. It is one of the ship drugs, if you remember. Sulfonamides, hydrolysine, isoniazid, procainamide. 4 important drugs which undergo acetylation. All drugs which undergo acetylation can cause SLE. And one of the principal symptom of SLE, presenting complaint mostly, is arthritis. So patient complains of arthritis, could be a case of SLE, try to avoid procainamide. Amiodarone causes fibrosis, that we have already seen. Verapamil, constipation is a huge problem with verapamil. So patient having GI problem, GI motility problem like constipation, do not give verapamil. Verapamil can cause AV block, so avoid in patients with history of heart block, and never give with beta blocker. Do not add verapamil with beta blocker, otherwise AV block will occur. Similarly, beta blockers also can cause AV block, avoid in patients with partial block. And beta blockers we all know can worsen asthma. So do not give in patients with history of severe asthma. Okay, severe asthma. Very, very important slide. Very, very important slide. It gives you in one slide all the major problems with all important anti-arrhythmic drugs. Okay, all important anti-arrhythmic drugs. So I hope it is clear. Any problem? Any problem to anyone? Any problem? Please go ahead. Please go ahead. बीटा ब्लॉकर एस्थमा में नहीं देने, वेरापामिल कॉन्स्टिपेशन में, एमिड्रॉन लंग डिजीज में, प्रोकेनामाइड in patients with arthritis suggestive of SLE, and diazepamide do not give because of anticholinergic property in patients with glaucoma. Clear everyone? Let's move ahead. Next important topic, sacubitril. Very, very, very important topic nowadays. It has come twice in last 5 years, once directly as a medicine pharmacology, and once it also came as part of CHF treatment in medicine. So very, very important topic, sacubitril. Sacubitril. Let us see. Is it a recombinant BNP? It blocks the breakdown of ANP, BNP and bradykinin. It is used along with valsartan in CHF. Sacubitril-valsartan is associated with increased angioedema and it's contraindicated with ACE inhibitor. Which of these statements are true? Tell me which of these statements are true statements. Which of these statements are true statements? Yes, very quickly. Sacubitril, very, very important drug. Sacubitril used in congestive heart failure. Several times it has been asked. You do not afford to have your questions on sacubitril wrong. They have to be absolutely correct, and you can do it. You can do it, especially if you have any problem. Subscribe to MedAce. Subscribe to the MedAce. Download the app right away. Download the app right away. How many of you have already downloaded the Manipal MedAce app from your app store? How many of you? Give me a thumbs up, each one of you who has already downloaded the Manipal MedAce app. You will forget all other apps. You go through the content, a lot of free content is available. You go through this and you will find you have excellent teachers, very beautifully made handwritten notes, electronic, digital notes are there, and the videos, their quality, the app itself is simply great. So subscribe to the YouTube channel and download the MedAce Manipal app from the Play Store right away. Let's come back. Sacubitril is recombinant BNP, false. Recombinant BNP is nesiritide. It blocks the breakdown of ANP, true. Used along with valsartan, absolutely correct. This combination has increased angioedema, false. It is contraindicated with ACE inhibitor, true. Why? If you add sacubitril with enalapril or ACE inhibitor, increased angioedema, but not with valsartan. With valsartan, angioedema does not increase. So which are the true? 2, 3 and 5. 2, 3 and 5, and option number C. Option number C. Okay. So this is our correct answer here, option number C. Okay. Welcome Nishant, and let us see, very, very important. Let's try to understand nesiritide, sacubitril and several other things. So please understand. You see, there is a peptide in our body called brain natriuretic peptide, BNP. BNP is good for CHF patient. So BNP is a peptide. It's a peptide in our blood. It causes vasodilation. It causes natriuresis. Both things are good for a patient of CHF. We want BNP to be high in patients of CHF. BNP is broken into inactive products, degraded by an enzyme that we call as neutral endopeptidase, also called as neprilysin. So BNP is a peptide good for CHF. It is broken in our body, in our blood by a peptidase called as neutral endopeptidase, also called as neprilysin. We have developed a drug that we call as sacubitril. Sacubitril, which is an inhibitor of this enzyme, neprilysin. So that is what is sacubitril. Sacubitril is not a BNP recombinant. It's an inhibitor of neprilysin, a peptidase which breaks BNP. Now, if we try and expand our vision here, then what we also see that there is another peptide in our body called angiotensin 1, AT1 or angiotensin 1. Angiotensin 1 is converted into angiotensin 2. You all know by which enzyme? By the ACE enzyme. And angiotensin 2 causes vasoconstriction, cardiac remodeling. So it is bad, it is harmful for CHF patient. We do not want angiotensin 2 to increase in patients of CHF. So what do? Which drug do we give in patients of CHF? We give inhibitors of ACE enzyme. This enzyme we inhibit, and these drugs are called drugs like enalapril. So I hope first thing you can see pril. First thing, pril, both are peptidase inhibitor. Sacubitril is a neprilysin, neutral endopeptidase inhibitor, and enalapril is ACE inhibitor. ACE is angiotensin converting enzyme, but it is also a peptidase. So pril, both are peptidase inhibitor. Now one more thing we have to add here to make this thing complete, and that is we have a peptide in our blood by the name bradykinin. Bradykinin is an inflammatory mediator. Bradykinin is broken, inactivated by both neprilysin also and ACE also. Both these peptidases break bradykinin. Both these peptidases. So now you will understand that if you add sacubitril, which is going to inhibit this enzyme, with enalapril, ACE inhibitor, which is going to inhibit ACE enzyme. If you add sacubitril with enalapril, then there will be excessive increase in the level of which substance? Bradykinin. Excessively, bradykinin will go up, and bradykinin is an inflammatory mediator. It will cause angioedema. So which drugs are not to be combined? Sacubitril is never to be combined with ACE inhibitor. That is why we combine sacubitril with valsartan, angiotensin receptor blocker. We do not combine sacubitril with ACE inhibitor. Okay, so I hope it is clear that sacubitril is a neprilysin inhibitor, never to be combined with ACE inhibitor. Otherwise, excessive increase in bradykinin and angioedema will occur. Okay, welcome Stardust. Good to have you in the session. You are a bit late, but we still have lot to cover. Lot going on. This is sacubitril versus ACE inhibitor. What is nesritide? Nesritide is a recombinant BNP. BNP synthesized in the lab is nesritide. Now, this question came recently in INICET, OMAP-petrilat. This question came about a year ago. OMAP-petrilat is inhibitor of both neprilysin, as you can see, and ACE. So it was called a vasopeptidase inhibitor. The class was called vasopeptidase inhibitor. It inhibits both neprilysin as well as ACE enzyme, OMAP-petrilat. As I have explained, if you inhibit neprilysin, bradykinin goes up. If you inhibit ACE, bradykinin goes up. So excessive excessive increased in bradykinin, and that led to very, very high risk of angioedema, and that is why this drug was banned. That is why OMAP-petrilat is a banned drug. It is not available, and that is why we never combine sacubitril with enalapril. So I hope it is clear. The entire theory, the entire concept about BNP, ACE, vasopeptidase inhibitor, bradykinin, and angioedema. So I hope you can answer the questions about sacubitril used for CHF in combination with valsartan, not with ACE inhibitor. Everybody clear? Any problem to anyone? Any problem to anyone? Okay. So should we move ahead? Stardust, what do you say? Should we move ahead? Okay. Moving ahead, we have what? Which statement about vancomycin? Vancomycin, such an important drug. Pharmacology, infectious diseases, microbiology. Every year, something or the other comes from vancomycin. Very, very important drug, not just in pharmacology, but in infectious diseases, in medicine, in microbiology. Anything about vancomycin you cannot afford to miss. Let us see which statement about vancomycin is or are true. Active against methicillin resistant staphylococci, bacteriostatic, binds to penicillin binding protein PBP, active against Pseudomonas, good oral bioavailability. Which statement about vancomycin are or is true? Yes. Go ahead. What do you think is the answer? Option number A, 1, 2 and 3. Option number B, option number C, or option number D? Yes, Stardust, Gokul, Vandergup, Nishant, Kyle, Dr. Babavi, Dr. Agathian. Which one is true? A, B, C or D? What do you think is the correct answer? Gokul says C. Gokul is the first to respond. Very good, Gokul. We must always develop this habit of reading the question correctly but quickly and arrive at our answer quickly. Save the time. Let's see. Active against methicillin resistant staphylococci. True. Those staph which are resistant to methicillin can be killed by vancomycin. Bacteriostatic. False. It's a drug acting on cell wall, and cell wall acting drugs are cidal drugs. So it is a cidal. Vancomycin. Binds to penicillin binding protein. No. It binds to D-alanine part of the cell wall, which is different from penicillin binding proteins. That is why it is used in methicillin resistant staph. Active against Pseudomonas. False. Pseudomonas is gram negative. Pseudomonas. Vancomycin does not act on gram negative. It's a drug for staph, gram positive. So it does not act on Pseudomonas. Good oral bioavailability. Absolutely false. Absolutely false. It is not absorbed when you give it orally. That's why we give it orally for Pseudomonas colitis, because we want drug to remain unabsorbed in colon and kill the Clostridium. So the drug is given only IV. Okay, it is not absorbed orally. So which of the following is true? Only one, and that is option number C. Option number C. Gokul, you are correct as most of the time, and so is Kumar. So good, Kumar, very good. Option number C. Now let us see vancomycin. Vancomycin, how to remember? By the name itself, vancomycin. Okay, I hope you are also following the Manipal Medes on Instagram. If you are not, follow Manipal Medes and myself also on Instagram. You will find a good Insta reel on this question. Vancomycin. How to remember everything about vancomycin? By vancomycin itself. First point in vancomycin. First point. V stands for vancomycin. It's a glycopeptide antibiotic. First point. Second point. Second point. How does it act? C. It's a cell wall inhibitor. Cell wall inhibitor. The drug has to be bactericidal. It binds to what? Binds to what? I told you. It binds to D alanine, D-alanine. There is this part of cell wall where it binds to and causes cell wall damage. D-alanine, D-alanine. Second point. Third point. C. Change. C stands for change. If this D-alanine, D-alanine changes to D-alanine, D-lac, if in the cell wall there occur mutation and instead of D-alanine, D-alanine there is D-alanine, D-lac, vancomycin cannot bind to such a cell wall. The staph will become resistant to vancomycin. So VRSA, vancomycin resistant Staph aureus. What is the mechanism? Change from D-alanine, D-alanine to D-alanine, D-lac in the cell wall. Such a staph is now resistant to vancomycin. Okay, vancomycin. Fourth point, N, no action on Pseudomonas, which I have told you. Vancomycin acts only on gram positive bacteria like Staphylococcus. It does not act on gram negatives like Pseudomonas. Fourth point. Fifth point, the drug is not absorbed orally. So how do we give it? IV. We give it IV for staph. How is the route? IV. Then sixth point, but sir, I have read that it is given orally for Pseudomonas colitis. Yes, it is given orally, but it is a local action. The drug is not absorbed. When you give it orally, it remains in colon, kills the Clostridium in colon, used for Pseudomonas colitis. By which route? Oral. It is a local action. If you want systemic action, you will have to give it IV. I hope that is clear. What are the important uses? Seventh, it is also a drug of choice for MRSA, methicillin resistant Staph aureus. MRSA, which is the best drug? Vancomycin. Vancomycin is the best drug. Seventh point. What are the problems? Histamine. We have taken a small liberty to create this mnemonic. Histamine means histamine release. Histamine causes vasodilation. So which syndrome? Red men syndrome. Which are the other problem? Auditory damage, ototoxicity, and last problem, nephrotoxicity. So 10 points, vancomycin summarized. How to remember? What is the mnemonic? Vancomycin. V for vancomycin, C for cell wall inhibitor, C for change, no action on gram negatives, only IV. Orally you can give it, but that's a local action used in Pseudomonas. It is drug of choice for MRSA, auditory damage, nephrotoxicity, and histamine release causing red men syndrome. Okay, so everything about vancomycin. If you want to revise, also you can refer to the Instagram reels by Medes. So follow Instagram of Manipal Medes and follow Instagram of Arpit Agarwal. I hope everything about vancomycin you will now never forget. Very, very important drug. Everything summarized in one slide. Okay, the questions can come in pharmacology, in infectious diseases questions, and in microbiology. Very, very important drug. Very, very important. Okay, so I hope everything is clear. Let's move ahead. Okay, so Stardust, it's good you're noting, but the session will be there on YouTube, so you can watch it later also. Let's try to make this session more interactive. Your participation is extremely important in the session. Select antibiotics which are safe in a patient with serum creatinine. Serum creatinine normal is around 1.2 to 1.5. Now it is 2.5. So we are looking at renal disturbances. We are looking at renal failure case. So which antibiotics are safe in patients with renal failure or raised serum creatinine? Very, very important question. As you can see, again this question comes in pharmacology. The questions also come in medicine when they talk about renal failure, and questions also come in various topics of infectious diseases. So very, very important topic. Antibiotics which are safe in patients with renal failure or raised serum creatinine indicating renal injury. Let me know. Tigecycline, cefoperazone, rifampicin, doxycycline, ceftriaxone, imipinam. Which of these are safe? Tell me. 1, 2, 3, 4, 5, 1, 2, 4, 5, 6, 2, 3, 5, 6 or 1, 2, 6. Which of them? Everybody is saying A, Gokul, Stardust, Gokul. Very good. So tigecycline, yes, it is safe. Cefoperazone, safe. Rifampicin, safe. Doxycycline, safe. Ceftriaxone, safe. Imipinam, no. That cannot or should not be used in patients with renal failure. So 1 to 5 are safe, and that is the A is the correct answer. A is the correct answer. How to remember now? How to remember? This is the mnemonic. What is the mnemonic? Can safely clear many new drugs. That is the mnemonic, can safely clear many new drugs. C stands for cephalosporins. So which cephalosporins? Two names come to my mind. Cefoperazone. Cefoperazone is cephalosporin, third generation, safe in renal failure. Also is ceftriaxone. Two cephalosporins which are safe in renal failure, very commonly asked as an independent question. S, streptogramins, the combination of quinpristine plus delfopristine. Quinpristine, delfopristine. Now you have to understand that most of the drugs, most of the antibiotics which are 50S binding protein synthesis inhibitor, they are safe in renal failure. So most antibiotics which inhibit protein synthesis by binding to 50S ribosome are safe in renal failure. That means S, streptogramin, C, clindamycin, linezolid, erythromycin, azithromycin, all these are antibiotics which are protein synthesis inhibitor binding to 50S. All of them are safe in renal failure. Rifampicin, the RNA polymerase inhibitor. So rifa drug, rifampicin, rifapentin, okay, rifaximin, all these are safe. Moxifloxacin is the only fluoroquinolone which is considered safe in renal failure. Why? The drug has biliary elimination. Nefcillin is the safest penicillin in renal failure, excreted completely in bile. Then even oxacillin is partially eliminated in bile, so that is also partially safe. And coming to tetracycline, doxycycline and tigecycline are the only tetracyclines which are considered safe in renal failure. So can safely clear many new drugs. This is the mnemonic to remember all antibiotics which are safe in renal failure. Can safely clear many new drugs. Very important from MCQ point of view, from a clinical point of view. You need to have these drugs on your tips. Okay. Particularly in this, rifampicin you should know, very commonly asked. Moxifloxacin you should know. Doxycycline you should know, and cefoperazone. These are the ones that are more important in this particular slide than other drugs. Okay. Stardust, first of all, minocycline is not so commonly used, but if there is a question where you do not find any suitable option, then you may consider minocycline as partially safe in renal failure. It has partial biliary excretion, so it may be considered, although it's not 100% or a very safe tetracycline in renal failure. Okay, so I hope now everybody knows the drugs, antibiotics particularly, which are safe in patients with renal failure, and how to remember them. How to remember again. Also, you can revise this on our Instagram channel. Also, you'll find a reel for this also. Okay. Antibiotics active against MRSA. Methicillin resistant Staph aureus. This is a topic which has been asked, I would say, at least 10 times in last 7 to 8 years across subjects. Sometimes as a question in pharmacology. Sometimes they give you MRSA in microbiology. Sometimes MRSA related abscess or meningitis appears in medicine. So which antibiotics are active against MRSA? This becomes a hugely important topic, not just from pharmacology, but from medicine also, particularly infectious diseases, also from microbiology. So antibiotics active against MRSA. You need to have these antibiotics on your tips. So select antibiotics which are active against MRSA. Ceftazidime. No. Beta-lactams do not act on MRSA. Daptomycin, yes. Vancomycin, yes. Clindamycin, yes. Meropenem, no. No meropenem. So 2, 3 and 4. These are the drugs 2, 3 and 4. Option number B. Very good, Gokul. Very good. Option number B. These are the 3 antibiotics out of the 5 which are active against MRSA. Now let us see what we want to revise here. So Staphylococcus, 3 kinds of Staphylococcus are asked in exam. Penicillinase producing staph, which is resistant to penicillin G. That is the commonest variety of staph in environment. What is the mechanism? It is the secretion of the enzyme penicillinase. This staph secretes penicillinase, which breaks penicillin G. So it is a penicillinase producing or penicillin G resistant staph. What is the drug of choice? We will give penicillinase resistant penicillin such as methicillin, or you can say oxa, cloxa, dicloxa, nefcillin. All these penicillinase resistant penicillin are given. Methicillin, oxacillin, dicloxa, flucloxa, nefcillin, any of them can be given. Then another staph is MRSA, methicillin resistant Staph aureus. Now staph has become resistant to methicillin, the one that were using earlier. How is this staph resistant to methicillin? Now the mechanism is change or mutation in what? Mutation in penicillin binding proteins, PBP. Mutations or change in penicillin binding proteins. What is the drug of choice? Vancomycin. Vancomycin is the drug of choice for MRSA. Vancomycin resistant Staph aureus. How is the mechanism? We have already discussed. Vancomycin resistant Staph aureus. Change occurs in the cell wall from D-alanine to, instead of this, the cell wall changes to D-alanine, D-lac, and this change is responsible for vancomycin resistant Staph aureus. High dose of daptomycin is considered the best drug for this kind of VRSA or staph. So 3 questions first of all. 3 types of staph: penicillinase producing staph, methicillin resistant staph, and vancomycin resistant staph. 3 mechanisms all are asked. What is the mechanism of this? MRSA, VRSA, what else? And then drug of choice. So 6 questions written in front of you. As I said, revise the topic in entirety. Complete revision, okay, of the important topic. Next, MRSA. Coming to the various drugs for MRSA itself. So vancomycin is the drug of choice. That is no doubt the drug of choice. What is the alternative if vancomycin is not available? Daptomycin is the alternative. So these are the 2 base drugs. Vancomycin drug of choice. If that is not available, daptomycin. What are the various other drugs which can be used? 5th generation cephalosporin. The best would to remember will be ceftaroline. If that is not given, look for ceftobiprole. Ceftobiprole. So Gokul, I think that answers your question. 5th generation cephalosporin, ceftaroline. and ceftabiprole, they are active against MRSA. Then newer drugs like telavincin, protein synthesis inhibitor like linezolid, very very important. Remember, linezolid is an excellent drug with oral route, can be given orally. Clindamycin. Then if you want a superficial topical drug to eradicate the nasal carrier stage of Staphylococcus, so MRSA has colonized the nasal cavity, you want a nasal ointment. Mupirocin is the drug, ointment which is active on MRSA or Staph, mupirocin. Tigacycline and newer tetracyclines like umadacycline can be. Only fluoroquinolone which is active is a newer one called dalafloxacin. Fluoroquinolones generally are not active. Only one which is active is a newer one, dalafloxacin, and finally cotrimox or rifampicin may also be used as add-on drugs. So very very important, very very important to remember all these drugs which are active on MRSA. So I hope everybody is clear. Gokul, you can see linezolid. It's one of the good oral drug for killing Staphylococcus. Good oral drug. Okay, moving ahead. Just a moment. So friends, I hope you are enjoying the session, finding the session useful. Let me know in the comment section. And remember, we are going to continue, we at Medace are going to continue to have these sessions daily till 20th of April, every day, new subject, new faculty, all important points about INICET covered. So do not forget to subscribe to the channel, hit the notification button and share these sessions. Very very important. Moving to the next question. Choose the true statement about aspirin. Aspirin is such an important drug in pharmacology. Aspirin. Choose the true statement about aspirin. Avoided in child suffering with chickenpox. Antiplatelet effect is due to pre-systemic COX inhibition. Avoided in gout because it can increase serum uric acid. In an afebrile patient, overdose of aspirin produces hypothermia. It prevents granulomatous lesion and cardiac complications of rheumatic fever. Aspirin, very very important but very very confusing drug in pharmacology. You must know everything about aspirin. Let us see. Avoided in child suffering with chickenpox. This is true. If you give to a child with viral diseases, Ray's syndrome can occur. Antiplatelet effect is due to pre-systemic COX inhibition. That is true. Pre-systemic. Cyclooxygenase inhibition is the main mechanism responsible for antiplatelet effect. Avoided in gout because it increases uric acid. Absolutely correct. In afebrile patient, overdose of aspirin causes hypothermia. False. It causes overdose of aspirin leads to uncoupling of oxidative phosphorylation. Mitochondria, instead of energy, starts producing heat and that causes hyperthermia. तो aspirin overdose में क्या होता है बच्चों? Hyperthermia, not hypothermia. It prevents granulomatous lesion, cardiac complication, rheumatic fever. False. No benefit occurs in carditis. In rheumatic fever, we give aspirin, but it benefits mainly arthritis and to some extent fever. These are the things which are benefited by aspirin in rheumatic fever. The cardiac complications or carditis, they are not benefited. Even chorea is not benefited by aspirin. So we have 1, 2, 3 is the correct. Option number A is the correct answer. Option number A is the correct answer. Let us see. The important points about aspirin can be remembered by the mnemonic. ABCD got pregnant. ABCD got pregnant, that is the mnemonic. Remember important contraindications of aspirin. A. Patients who are having history of asthma, do not give aspirin. Aspirin can increase leukotrienes, and that can cause bronchoconstriction. So aspirin can induce or worsen asthma. Do not give in patients of asthma. Aspirin has antiplatelet effect, so it makes the blood more likely to bleed. So therefore, any patient who is at a bleeding risk, peptic ulcer patient, hemophilia patient, do not give aspirin if there is a history or risk of bleeding tendency. Children who are having chickenpox or other viral diseases like influenza, if you give to such children aspirin, there can be liver damage and there can be encephalopathy. Reye syndrome is what we call this. So do not give to children who are recovering from viral illness like chickenpox or influenza. Do not give in diabetics, it can cause hypoglycemia. Do not give in gout at normal dose, that is less than 2 grams per day. Aspirin causes hyperuricemia, it will worsen gout. And do not give in pregnancy also, especially in the 3rd trimester, by decreasing the prostaglandins. It will cause premature closure of ductus arteriosus if given very frequently or if given especially in the 3rd trimester. So do not give in pregnancy, especially in 3rd trimester. So these are the important points that you need to remember about aspirin. Clear? A, B, C, D got pregnant. A for asthma, B for bleeding tendency, C for children with viral diseases, D for diabetics, G for gout, P for pregnancy. A, B, C, D got pregnant, and you have revised most of the important points about aspirin. Moving ahead, again match the following. Very commonly we are seeing this topic being asked. Lipid lowering drugs. Hyperlipidemia is such an important disease nowadays. Lipid lowering drugs are very commonly asked. So match the drug in column A with its mechanism in column B. You have fibrate, statin, ezetimibe, niacin, evolocumab. These are the various drugs, lipid lowering drugs. You have to match them with their mechanism of action or role in column B. Inhibiting hormone sensitive lipase. Inhibiting HMG coenzyme reductase. So this one, I know. Statins, very important drug. So 2 will go with B. I look at all the options and 2 going with B is there only in 1. So as I told you previously, employ this particular tactic and sometime you will find the answer. So this is what the correct answer. So fibrates are PPAR alpha agonist. Ezetimibe blocks the NP-C1L1 protein. It's a transporter in your GIT. Ezetimibe blocks it, prevents absorption of cholesterol from GIT. Evolocumab, aliracumab, these are PCSK9 inhibitor, very commonly asked nowadays, PCSK9 inhibitor, and the remaining niacin is a hormone sensitive lipase. So that is what you need to remember, particularly this one, evolocumab is very commonly asked, the PCSK9 inhibitor. Let's see. This is what is this important lipid lowering drug. Now see, statins are acting in liver. Please understand. They inhibit the enzyme HMG coenzyme reductase. Cholesterol is not formed. So they decrease cholesterol synthesis in liver. Statins are acting where? In liver. There is a new drug which is called bempedoic acid. This is a new drug, bempedoic acid. It is also acting in liver. Also acting in liver like statins. Inhibits the enzyme ATP citrate lyase. This enzyme is inhibited by this new drug, bempedoic acid, and it is thought, we are thinking that this will become a major drug in our fight against hypercholesterolemia in future. So very, very important. This drug is available in market. Question is expected in INICET. Very, very important drug now. Another drug, ezetimibe, I told you, acts in GIT, inhibits cholesterol absorption, and PCSK9 inhibitor. PCSK9 inhibitor are sorry, drugs like Evolo or Aliro, QMAP. These are PCSK9 inhibitors. Okay. So mixed bag. We've joined now. Good to have you. We are discussing some very important drugs. Okay. So now these were the important things I wanted to discuss with you today. I anticipate that these are some of the most important topics and drugs which are likely to be asked in upcoming INICET. So I hope you all enjoyed this session. But this is not the end. As I said many times, we at Manipal Medace are continuing to have these sessions daily till 20th of April. Tomorrow you are going to have another beautiful session from our all-time favorite Dr. Meenakshi Sundaram on biochemistry. So do join in for that session also. And please do not forget to hit the subscribe button and also download the Manipal Medace. Okay. So I hope you all enjoyed this session, learned a few new things, learned also a few new tricks to remember some important drugs, and I hope you will share it with your friends and download the Manipal Medace and join us tomorrow at the same time on your favorite Manipal Medace YouTube channel for another session from Dr. Meenakshi Sundaram. So till then, this is Dr. Arpit signing off. Thank you all for joining. It was great to interact with you, and I hope to see you again, this time on Manipal Medace app. I'll be there to solve all your questions. Thank you all. Have a great day ahead.